Hello everyone. Today we are going to see one biochemistry case study. A woman, a 52-year-old diabetic patient has been more feeling more weak and fatigued than usual. So he might have noticed her blood sugar has been slightly higher than usual, and his family members notice she not being herself and think that this could be due to the stress that is going through. And after a few days, Mary seems confused and shortness of breath. She's always drinking water and constantly leaving to use the restroom, and she takes insulin shots every day to control her type 2 diabetes. And after about 5 days of this odd behavior, her husband decided that she should go to see the hospital, the doctor. During examination, nurse notices the Mary's breath is very sweet and it is almost a fruity smelling. After looking at Mary's medical charts to verify that she is a diabetic, the nurse immediately informs the doctor the Mary's symptoms. So, what are the questions to be considered here is how would you diagnose the patients and what does you have to perform, and what are the diagnosis and the treatment. So, diagnostic testing, it involves collecting the urine samples and to test the ketone levels in the urine. If the result shows that the urine is positive is ketones, because of this the doctor orders a blood test. So in ketone bodies there are mainly three types: acetone, acetoacetate and beta hydroxybutyrate. And commonly a beta hydroxybutyrate is measured in blood. So results depict a high level of beta hydroxybutyrate in the blood. So without insulin, the body cannot use sugar properly for energy. So this leads to the release of hormones that break down fat as fuel, which is commonly called as ketones. So it is normally produced in liver, and excess ketones can build up in the blood, and this will lead to the higher acidity in blood. So diabetic, we have concluded the diagnosis as diabetic ketoacidosis. So the doctor keeps Mary overnight and administered fluids and electrolytes like fluoride, potassium, sodium and insulin therapy. And it is commonly occurs in those with type 1 diabetes. However, like in her case, it can also occur in those type 2 diabetes also. So what are all the treatments, which includes and drugs, which includes fluid replenishment, electrolyte replenishment, insulin therapy, that is the insulin reverse the process that cause diabetic ketoacidosis, and insulin secretion is regulated by glucose levels, and insulin regulates glucose metabolism, that is glycolysis, and it also stimulates lipogenesis, lipolysis, and just increases the amino acid transport into cells. So coming to the insulin pathways, the glucose is stimulated during the increase in blood glucose leads to the uptake by pancreatic B cells, and glucose is oxidized to pyruvate via glycolysis cycle, and pyruvate is oxidized by pyruvate kinase resulting in acetyl-CoA, and acetyl-CoA is oxidized by TCA, which is nothing but tricarboxylic acid cycle or citric acid cycle or Krebs cycle, and resulting is NADH and FADH2, which is oxidized via oxidative phosphorylation, and increased ATP inhibits the potassium ATP channel, and the membrane depolarizes leading to an influx of calcium ions and the migration of insulin containing vesicles to the plasma membrane, and finally insulin is released into the bloodstream. So impact of diabetic ketoacidosis is very treatable, and sometimes previously undiagnosed diabetes is found because of DKA, and complication, which is a very low blood sugar, that is hypoglycemia, and very low potassium levels, that is hypokalemia, and swelling in the brain, that is cerebral edema, and adjusting blood glucose level, and more seriously if left untreated can lead to the loss of consciousness or even death. Thank you.